When it comes to the onset of Botox and the durability, it depends on how I use it. That will determine what I'm seeing. So for example, for pain, to treat points of pain in the way that I've invented, the result is instantaneous, 1 second. I know that sounds weird, but that really does work. If you've been my patient, you know that to be the case. There can be a little bit more improvement in about 2 days, but that's usually about one second of onset. And it lasts somewhere about 3 to 4 months the first time. And if it's not severe, I can usually get, after a few rounds, to last longer and longer, 6 months, 9 months, sometimes a year, but not always. For wrinkle treatments, the onset is that's everyone knows about, between maybe 12 hours to 1 week, somewhere in that range, with the majority happening within 1 to 3 days for effects. That result lasts 3 to 4 months, but as you know, if you've been doing Botox for years, recurrent treatments allow the muscle to be weaker, the skin to be stronger, and it to last longer and longer, and hopefully even 6 months to a year if it's being built well enough. The final category is MesoBotox, which is skin rejuvenation. That really takes a minimum of 2 weeks to start seeing a change, although you could see it earlier. Really starts optimal results in 4 to 6 weeks. It really lasts, in my opinion, years. I mean, after a year, it still looks better. But it's better to stack it, especially if you're trying to change color, texture. Texture is pretty fast, but color and tone if you stack another round in a few months, it gets better and better and better, and you need less and less and less. So that's just a concept of Botox intervals, depending on how I use the treatment.